Clinical case explanation. This is a male infant hospitalized in the ICU with a functional tracheostomy and gastrostomy tube and a high risk of falls. During a physical therapy intervention, the child was stimulated in a long sitting position with continuous head and neck support, where maneuvers involving sensory stimulation and joint approximations were applied. At the end of the session, 2:40 p.m., when the infant was transferred from a short sitting position to a supine position, and despite bimanual head and neck support, the tracheostomy tube became dislodged. Immediate medical attention was provided and treatment was taken. The infant presented cyanosis, indicating acute respiratory descompensation. The airway was subsequently stabilized, and the situation was communicated to the relevant teams and caregivers. 1. Patient-related factors, complex clinical condition. The infant had a tracheostomy and gastrostomy tube and was in the ICU, indicating high medical fragility, high vulnerability. The infant's high risk of falls and total dependence mean that any manipulation requires extreme caution. Individual professional factors, clinical overload of the intervention. The session included multiple postural, sensory, and motor techniques, which could have increased the risk of accidental disconnection if clinical objectives were not prioritized. Lack of assistant personnel during the procedure. The intervention was performed by a single therapist with no additional support reported for a highly complex patient. 3. Team factors, possible lack of prior coordination with nursing or respiratory care. No mention is made of waiter. There was a joint plan for the safe manipulation of the infant with a tracheostomy. The disconnection could have been prevented with collaborative support. Lack of double checking of the device before and after the position change. 4. Environmental factors, possible space limitations or physical conditions of the area. The space and type of soft equipment used are not detailed, but in the pediatric ICU, it is essential that postural changes be performed under optimal conditions and with adequate support elements. 5. Organizational factors, absence of specific protocols for physical therapy interventions in infants with tracheostomies. If there are no institutional guidelines for this type of patient, each professional acts according to their own criteria, which can be a risk in such delicate procedures.